Welcome back to the Atlanta Dental Spa podcast, where our mission is to create an exceptional dental experience through comfort, compassion, and expertise. For over 20 years, we've been the leader in Atlanta for general, cosmetic, and surgical dentistry. So today, got another partner, another Atlanta Dental Spa partner, Dr. Jason Hamilton. He laughed. I was going to say like a Dr. McDreamy or something like that, because I hear this a lot about him. But leading the Johns Creek location, and you've done that for, geez, how long? Since it opened, since inception.
Since inception, it was. We opened up that location right after COVID.
Yep. Right. That was a COVID.
That was an interesting time.
That was fun.
Yeah.
That was fun. So I always refer to you to other people. First off, everyone in dentistry seems to know you, and I always refer to you as the doctor who teaches other doctors, right? The dentist who teaches other dentists. And like that was pretty much your whole come up in dentistry, right? Like
yeah.
you were the lead. I'm gonna mess this up. Like the resident, the lead chief resident, where you instructed other residents. So that's why you know all the things about dentistry. I feel like it was always intimidating just to even have dental conversations with you. So
whatever.
So you do have a lot of swag. So what we're going to talk about today is, because I think this is something that when you became a partner, you really kind of pushed in our ecosystem, which was the concept of sedation dentistry.
Right.
And I think you saw what it did so well in a clinical or university setting, right? In a surgical residency setting, and you saw what it did for kind of the people there.
Right.
Remarkably, I did some research, and 55% of U.S. population did not visit a dentist last year. I mean, you've heard that.
I have heard that.
And what would you say is, I mean, obviously there's some cost considerations, right? But like, would you guess, and there's no data that's really going to point to this, that a lot of it's fear-based. 100%. So I've been the recipient of some sedation dentistry, and I got to say, Doc, when I woke up, I was like, why was I not doing that all along, right? Didn't really remember the procedure. So I'm gonna kind of shut up here but give the wind up about why you thought it was really important to bring, and then also like the fact that not many dentists can do it. I mean, there's rigorous protocol that you have to go through, and like 4 or 5% of dentists are IV certified, maybe less.
Probably less than that.
Okay,
general dentists definitely.
So briefly explain, if you wouldn't mind, the levels of sedation, because sometimes people hear, "Oh, I got nitrous, I got sedated." Like, no. "Oh, I got I took the sleeping pill, I got sedated."
Right.
And so briefly describe for everyone, because I think this will really help the people who are on the fringe of like, the dentist is terrifying.
Yeah.
Okay.
So there are a bunch of different levels of sedation, as you said. Nitrous oxide is probably the most superficial of all of them. I mean, it basically kind of just takes the edge off. The advantage to nitrous is that you basically can get on it, and then you can come off of it
super fast.
You can drive home.
Afterwards. So super reversible. Yeah.
Very reversible. You breathe some oxygen for about 10 minutes at the end of the procedure, and you're done. You're clear.
So that's good for someone who's got just like a level of anxiety. Like, maybe they had something in their childhood, maybe not super traumatic, but it's just a nice. Someone used to describe it. I used to have someone that came in and describe it as like a couple glasses of wine kind of feeling.
Yep. A siesta.
A siesta.
Yep.
Okay.
Yep, absolutely.
All right. So that's level one. Level two is with, I'll let you go.
It's when you start combining medications, or you can start off with just the pills. Okay. Oral medication and oral sedation it's good to get you in the door. It's good so that you get a good night's sleep the night before. But it's not something that by itself is going to really erase all of that fear that you're talking about. It's going to just kind of, again, like nitrous oxide, take the edge off.
Okay.
It'll make you more relaxed. You do have to have a ride if you're going to be on any of these medications. So that's one of the downsides of taking the pill medications, the oral medications. But it's just a lesser degree of sedation.
Anti-anxiety, right? What is
Anxiolytics.
it? Anxiolytics, right? Which they are prescribed to be anti-anxiety. So it's meant for just that purpose.
Right.
But you're right. I always forgot about the fact that there had to be it's kind of a certified ride home, not an Uber, right? Not something like that.
We're not going to put you in a car with a stranger if your memory's erased.
Right.
That doesn't make sense.
All right, and then kind of the highest level of dental sedation, I guess, before you would have to go intubated into a hospital setting, right? and we're going to talk about IV sedation, which is not intubation,
Right.
But it's the highest level of sedation. And then talk about again why you've pushed the Atlanta Dental Spa kind of ecosystem in that direction, if you would mind.
So the definition of conscious sedation is whenever you have more than one pharmacological agent creating that anxiolysis that you were talking about, the anti-anxiety component to it. A lot of doctors, general dentists in particular, will use the oral medications that we were talking about. I just wanted to touch briefly on this. And as long as they're using more than one, or they're using certain dosages of a specific type of medication, that's considered conscious sedation.
So we're even in the pill form you're still talking about?
Pill form, nitrous oxide, it doesn't matter.
So they give combinations of?
Correct.
Okay.
So the downside of that, and the reason why I'm not an advocate of it at all, is because everybody responds differently to these medications. You know, I can throw a pill at you, and you can respond completely differently from somebody else that I throw a pill at, right? So you take a pill before you come in or after you get to your dental appointment. We have to wait 30 minutes to see what happens. What if it's not enough? I give you another pill. We wait another 30 minutes to see what happens. What if it's too much? Very difficult to control that type of situation, okay? So that, in effect, in my opinion, is very dangerous because you cannot titrate to effect, okay?
Titrate to effect. What is that? What do you mean?
So that means incrementally giving small amounts of medication until the patient is relaxed, you get the desired effect,
Okay.
and they're safe.
Safe. Okay, got
That's
it.
the key. Because, you know, like I said,
Because sometimes it swings too. You're saying titrate is if you give here's another one, here's another one. The pendulum swings too far for
Right.
someone. Okay.
Not only could it be a waste of time on one end of the spectrum because you're constantly administering medications until you get a desired effect, but then if you go too far, then you've got a whole other set of situations and concerns and potential emergencies that you have to deal with. So, back to your point, the reason why I advocate for IV sedation is because you have that ability to titrate. That is like my biggest thing with IV sedation. I can keep somebody completely safe the entire time. It doesn't matter what their history is, how they respond to these medications, how their physiology responds specifically, being the person that they are. Because some people will take a very small amount, some people will take a large amount. If it's the first time I'm sedating you, I don't know what kind of person you are.
But because you have kind of the access through the venous system, right? You can instantly know how someone's responding versus the pill. You're waiting for the GI to get in the blood.
100%.
Got it.
Yep,
Got
it's
it.
a direct line, and I can give those small amounts literally
Drop by drop.
Yeah, drop by drop, and do it over the course of maybe a minute or two. And then I can watch the heart monitors. I can watch everything that we have hooked up to you to keep you safe. Make sure that everything is within the safe spectrum, and then we can get to work.
And the dentistry. People think that. So the difference is that people think, well, I don't want to be asleep during dentistry, meaning like I don't want to be. They're thinking like the hospital setting, like
Right.
being intubated, where you have to you're getting breathed for and all that. You're conscious, right? You describe that a little bit, meaning you can still. In the times I've seen it, right, when I would have someone sedate for doing a big veneer prep, right, you can still not converse, but you can give instruction and kind of, you know.
You respond to very light stimulus.
Okay.
I mean, you can respond to commands. If I tell you to open wider, you'll open wider.
Okay.
Turn towards me, that kind of thing. The wonderful thing is these medications just erase your memory. You're not going to have any memory of doing any of these things, but that conscious aspect of these particular types of medications that we use allow you to be cognizant of what's going on in the moment.
But not remember what you
Not
what you were
remember
going
any
through.
of it. Nope.
So I guess in a situation like that, really the hardest part of the procedure, and I'm not laughing, but is really just the first getting the IV in, right? And that's not even, you know, if someone like yourself has done thousands,
Yeah.
that's not even the hard part, right?
Yeah.
And then it's dentistry pretty effortlly.
Really
Where
is.
where have you seen it be? First off, where have you seen it done? Have you ever seen it done for someone just for a cleaning?
Yes,
You have.
I have.
Have you ever done it for someone just for
I
a cleaning?
have multiple times.
So like the alternative for someone like that is like, this is why I think it's great, is because that person, right, deep fear, something terrible happened
Right.
in their past, more than likely. And the alternative is, I'll just never go.
Right. Seen
Right.
it happen time and time again. And the terrible part is what gets them in my door, and usually they're crying, terrified, shaking, all that fun stuff, is pain. That's what gets them in my door.
Oh, pain of having a dental problem.
Pain in their mouth.
Yeah. Okay.
An infection, something
So
serious.
the pain in their mouth overrides their pre-existing fear, and they need to do something.
100%.
Right. Right. Because honestly, I guess really the only dentistry, there are some medical necessary things, meaning an extraction can be life-threatening. If you don't get an extraction, that can be life-threatening. Most of dentistry is elective. Right. We've described kind of what it is, and we've described obviously on the light end of kind of the giving it to someone who's had just a cleaning. Describe where you find it's like the perfect base hit for it, right? Like the perfect procedure that you're just like, okay, this is what it was designed for.
Okay. So it is a combination of, most people have apprehension about being in my chair. And I'm no fool. I know that's going to be the case the majority of the time, actually. But when patients, either through neglect or some other reason, have a lot of dental work to be done, a lot, this is perfect because it cuts down on the number of appointments. It cuts down the times you have to come visit me, which is great. And I can get more done in that one appointment than I would in an appointment when they were completely awake or not. And
just being numb, potentially, because then,
correct.
Okay, right. So efficiency, I do think that is important. You get more done. So typically, I'll just do the wind up for everyone kind of listening. If you do the crown of the year kind of thing, right? You're coming in, you're having the crown prepared, you have a temporary put on, then you come back weeks later and you have the permanent put on. So there's economies of scale with it, or scale of your time in this instance, that you get to do so much more. And I think honestly, and you would argue with me, that it's better quality dentistry, meaning when you can address something more comprehensively, as opposed to let's do this one this year and this one next year and this one next year. You can address it more with the end plan, like you're building a house almost, right? As opposed to we're going to add this room one year and this room the next year and this room. It's no, let's just design it all really well with the end in mind, kind of thing.
And not only that, but it's just more efficient. I mean, the efficiency doesn't mean you're doing it faster.
Right.
You're not speeding through things. It means that if I know that you're comfortable, guess what? I can work more efficiently. And so it cuts down on actually the amount of time you're in my chair still.
Right. And the number, and definitely the number of visits because of...
if you have work that needs to be done on both sides of your mouth, and say, for example, it's a crown, which is a 2-step procedure. If you split that up, that's 4 appointments. If you do it all together, it's 2.
Still 2, right? So the people out there that are needle phobic, is there anything that you guys is there anything that is put on? I don't know really the answer to this. Anything you put on to the arm before?
Typically what I do is nitrous.
Okay.
Yeah.
So nitrous
works
before you start.
100%. So
why don't they do that at the hospital?
I don't know. Nitrous has an analgesic effect, so it makes you just kind of, if anybody that's experienced nitrous, you feel like you're kind of floating. Tingly. You literally lose some of the sensory perception, particularly in your extremities, which is perfect.
Yeah. I've never heard someone say, "God, they really need to you need to go give a course to the hospital."
You used to do it all the time.
That's pretty cool. That's pretty cool. So how long can you safely have someone in sedation for a procedure? Because someone out there may be thinking, well, my mouth, it'd take all day kind of thing. I can't be sedated that long.
All day is the correct answer.
Really?
Yeah. People in hospitals are on IV drips of the same stuff that we use for conscious sedation for days. Yeah.
Really?
Yep. Midazolam drips. Yeah. Absolutely.
Okay, so there's really no limit to your, obviously.
There's a limit.
Technically no limit, but there's a limit. But you do, right, when someone sees you're doing you personally, you do very complex dental procedures, whether it's dental restorative, complex cosmetic stuff, or you're doing things like all on X or something like that, which is where you're basically putting in a bunch of implants in someone's mouth, right? And all of those are facilitated with sedation much better, because honestly, you probably couldn't break some of those up in good,
yeah. A lot of the procedures that I do, particularly the more comprehensive ones, the complex ones where you're doing crown and bridge and doing implants, particularly at the same time, it all has to be built together. If you can't just split it up, okay, let me just do the top and do the bottoms. It's very challenging to do that. If you do it, the design's somewhat compromised. you're going to be functioning inefficiently for a while. It's very awkward, very uncomfortable, that kind of thing. So a lot of these bigger procedures have to be done all at once, ideally, in order to get the proper result. If you don't do them that way, then you're going to have a problem potentially.
What when you see people that come in and you're talking sedation with them and they're saying they want it, like what question do they have? What do you hear the most, like surrounding that whole idea from patients, prospective people?
Regarding sedation?
Yeah, like once they're like, all right, I want sedation, like what do you hear is the next thing out of your mouth? For example, like when someone, I always say after someone does their smile, right, and they have their veneers, the first thing that you say is, oh my gosh, I can't believe I waited so long, kind of thing.
Right.
Like what is the thing that you hear the most? Like, am I going to be asleep? Is my choke on my tongue? Like you hear all these things. Maybe there's no commonality, but I'm sure you hear all sorts of things.
One of them is, am I going to wake up?
Am I going to wake up?
Yeah.
Okay.
That's one of them. And I don't hear that as often as you would think, but
I think that's super common. I mean, meaning you hear that when people go to the hospital, right?
But like people are seeking me out specifically because I do this. So they already know that I'm doing it. That's why they're here.
Okay.
But occasionally I will hear it. And what I remind them of, or they may not know to begin with, is that sedation dentistry was created for cardiac patients. It's created for people that are not healthy. So it is extremely safe.
Wait.
Yeah.
Unwind that.
Okay.
Or unpack that a little bit. So it was created for someone who was not healthy, meaning there was a weak heart or some kind of compromise. Okay, so explain that.
Okay. So somebody who has some sort of part of their system that is not working or functioning correctly.
Okay, so bad.
We'll say bad ticker.
Okay.
Right?
Bad heart.
They have a bad heart. The idea is to reduce the amount of stress. It doesn't matter what they're doing. Reduce the amount of stress with exercise, reduce the amount of stress with a surgical procedure, doesn't matter. So the idea behind conscious sedation is to reduce the stress on the heart to make sure that compromised heart does not have a problem during the procedure.
So you're saying by reducing the anxiety and reducing the situation that they're perceived in, it doesn't put a strain on the heart.
It relaxes the heart.
No way.
It keeps the blood pressure down, keeps the heart rate down, the entire procedure. That's one of the main points of this whole thing.
And so without that, right, like everyone knows that inside the anesthetic is something called a vasoconstrictor, right? That keeps everything in the area of keeping you numb. But the vasoconstrictor is like an
adrenaline shot.
Adrenaline shot, right? And so it makes your heart race, and now you're scared.
Yep.
Now your heart's racing, and now you have a bad heart, kind of thing, right? And so sedation is the perfect instance for this.
100%.
That's awesome.
Yeah.
That's awesome. I learned something every day. Didn't know that actually.
It happens.
So I have a few questions here.
Yep.
That kind of came up in my research. So why is it the no memory thing? Reading, because I think people would love to. I didn't remember my dental procedure, right? And I think like most people, I was like, that's fine with me. Like, what is that? What does that amnesia affect?
So the benzodiazepines, which is one of the medications that we use, that is specific to that medication.
Okay.
That particular drug class.
Okay.
It literally just wipes out your memory. And there is actually certain times when it can be retroactive, where it actually you don't remember coming into the office.
Right.
That's very rare. But it will be a little bit past the appointment typically.
No one seems to mind.
But no, they don't. I mean, they wake up in their bed at home watching Netflix. It's no big deal, right?
Is there any other? So let's go back to the 4% of the population, because if someone Googles sedation, you do see a ton of offices that kind of we offer it, right? And then, so I always tell people, just make sure that it's a verified IV sedation with the proper permitting. I mean, there's every one of our locations has it, right? And you have to have, all these crash carts, and you have to be certified through, you talk about that because you know way more about this than me.
So you have to obviously have the equipment. You have to have all the emergency equipment if something were to go wrong.
Just like a hospital would.
100%. Right. We have a crash cart. We have all the medications that are responsible not only for reversing the medications that we're using, but also the ones that we may need to use in case some other unforeseen emergency arises. So we've got all that done. We've trained to use all of this stuff as well. We are all trained in ACLS, acute cardiac life support, which is a step above basic life support or CPR. So we're all trained in that. Plus, we've taken extensive courses. We have to do extensive CE courses every year to make sure that we're up to date on every new aspect of conscious sedation. The actual venipuncture and IV sedation is also special training. There are not many people that know how to do that, and definitely not many general dentists. I mean, you'll see it in oral surgery and things like that.
And is that because they don't want the liability, or is it because the certification is so long? Like, why would you say here's where I'm going with this, Doc, is that I think it's one of the greatest things to exist in dentistry. I really do, because I've seen it.
Me too.
I've seen so many people get off the sidelines of being like, I'm just going to, either they're going to do their smile or going to do their all next. They're going to do the big thing, and it's no longer the impediment to their care.
Right.
Right. And so if that is kind of the antidote for their fear or getting what they want, then why aren't more people offering it?
That's a good question.
Because all 5 locations at ADS have it, right?
Yeah.
And
I think part of it is fear. I think getting past the whole venipuncture thing is a huge barrier for the dentist to get into the aspect of actually.
We don't like giving injections outside of the mouth.
Exactly.
Right. Okay.
And I don't know why that is, honestly. Okay. I ran a residency program at the medical college in Augusta, and everybody was sedated, and I got to see the worst of the worst down there. I can't imagine doing dentistry without it, to be totally honest with you.
Interesting.
But there were a handful of my residents that went on and did not continue doing the sedation. And I have asked them why. And part of it was the setup, to be totally honest with you. They weren't willing to go through the initial cost of getting everything. And it is an investment, but it is very worthwhile. Going through the investment, and then also the liability. Now, the liability can be, described in a couple of different ways. One of it can be insurance, malpractice insurance. It doesn't affect malpractice insurance all that much. But the liability of handling patients in that way, it just kind of freaked them out. They were like, okay, I know I can do the dentistry. I know I can do it really well, but I'm still a little uneasy about this other thing. And that was basically what did it for me.
And I see that a lot with working with a lot of dentists out across the United States, that people are working on an island. They feel like they almost are working on an island by themselves, and versus like at ADS, with your community, like, hey, what do you think about this? Let me look at this. But if you're by yourself, kind of just lone wolfing it, I don't know if I want to do this anymore, right? There's some fear to that. So maybe that is the answer. Okay. Yeah. Even if you're not scared, I think it's something that you should consider, because it just makes it so much streamlined. Like it just what modern dentistry should be like.
Well, you asked me earlier, like, alluded to the 2 different factions, the 2 different types of people that I see and that want sedation. One is the fearful patient. So to get across to them that it's okay, get past that first most difficult step, which is walking through my door.
Right.
We can talk to you about what your options are and how this can be, no matter how fearful you are, no matter what's going on in your mouth, how much pain you're in, that you can get yourself healthy again. And this is a great adjunct to that. This is one of the only ways I've been able to work on some of my patients.
Yeah. And
I've gotten them from being completely devastated orally to functioning better than they have in decades.
So what's the second type of patient?
So the second type of patient that I run into that benefits immensely from IV sedation is the patient who doesn't have any time. I run into all these type A, CEO kind of people that just literally, they're like, I literally have to be out of here in 15 minutes. I know I've got a lot of work that needs to be done. It's been years since I've been to the dentist. Just shoot me straight. Tell me what I need to do.
And what I need to do, and then how consolidated can you make my treatment?
100%. I was like, well, okay. So the thing is that a lot of these guys, girls, they have a lot of work that needs to be done because they have been so busy that they've neglected certain things. And it's no fault of theirs. There's just, everybody makes the excuse there's not enough time in life, and they've done that. So once we get everything figured out and diagnosed, instead of them coming back for multiple appointments, working on this side, working over here, fixing this problem, fixing that problem, if we get everything in one big treatment plan.
Commuting in Atlanta traffic.
Yeah, exactly, right? If we get everything down that needs to be done and the plan works, we get it designed correctly, we literally, with IV sedation, because I can do a procedure that nobody wants to stay in my chair for more than an hour and a half at the most.
When they're not sedated.
Right, when they're not sedated. When I have a patient sedated, I can leave them, I can bring them in and have them all day. They'll be the only patient that I work on all day. Okay, so I can devote all my energy, all my time, get all of the work done, or the majority of the work done. Sometimes it takes 2 steps, which means 2 appointments, which is better than 8 appointments. But I can literally get all the majority of the work done one day. They go home, they relax, they can function on that. They come in the second time, and I get it done.
All right. So what would you say that mix of spread is? So let's break it down. Really, the 2 classes of people that you say are your sedation clients, if you will, are the people who are fearful, right? Which we just described how perfect it was designed for those people, and then the people who are seeking efficiency of 20 years of dentistry in one day.
Correct. That's a perfect way to describe it. Perfect.
Got it. You know, the interesting thing that I would hear, and I'm sure you hear this so many times, is people will come in being like, "Oh, I know this is the worst you've ever seen," and everyone has this perceived notion of their mouth, right? Especially when they've passed the point where they know there's been neglect, or they're like, "I'm not going in, I'm scared," and they're like, "Oh, this is the worst I've ever seen," and like, you see it, I'm sure you see it, and you're like, if you only knew, right?
I saw it earlier this morning. I saw worse.
Yes, right. Just this morning.
But and a lot of it, fear is part of it. Embarrassment's another part, another key component to all this. And that's something that we strive to make sure that this is a no judgment zone.
I love that.
Judgment-free zone. You come in and see us, and we just want to make you healthy.
But most dentists, I got to tell you, Doc, they do not. There is a little bit of weird shame in our industry. And I'm not throwing shade at dentists, but like what my dream would be that the notion of, where have you been for the past 10 years, or why are you just coming now? And like those are just thrown away. The fact that someone has presented now should just be, we got you.
Yeah, 100%.
We got hope. We got you from here. Don't worry.
And there's a way to create ownership in what's going on without shaming them.
Totally.
I mean, there's a way to break through that barrier and kind of do that journey together. It's not something like, this is your problem. You're going to deal with it, and I'm going to tell you how to deal with it. And you just got to do what I tell you to do. That's not the way to handle the situation.
Yeah. I think that the industry, for example, when I was growing up going to the dentist, right, I think there was some the way dentistry was done, and I think we are now having to fix that. The pendulum, people being scared, people having bad experiences.
Yeah.
And now like it's this I think it's this level of compassionate dentistry that I'm seeing on the rise, more so than anything else, and I'm really proud of that. But I still hear those stories of someone being like, I got shamed and I got told get out of the office, and where was I for so long? And I'm like,
that I was
my God.
Crazy.
Yes,
that kind of thing. Yeah.
Yes. Yep. Yes. All right, buddy. That's a good one.
Awesome.
See you next one.
Yeah. Fantastic. Thank you.